Now, Larry, is this your announcement that you've gone over to the FCC, to the dark side or something?
No, just a quickie. How many of y'all familiar with the FCC program for rural healthcare? Rural healthcare initiative. Okay, there's a fair number of you. I helped write the Texas proposal, and I'm one of the ones that helped or involved with the Internet 2 coordination of this. We have Friday calls and things like this. But one of the original caveats that I put into the Texas proposal was to relax the restrictions. Y'all are all familiar with eRate. Mm-hmm. Well, eRate is anal and it goes downhill from there. And I've cleaned my language up for this one.
That's all right. We've been talking about toilets and other
yes.
things.
The rural health care program has had $400 million authorized for the last 10 years per year. They've averaged 44. So the pilot program is a way of jump-starting that program, but also developing a new criteria for eRate as well as rural health care. So one of the things that's really, really, really important is to beat up your local rural health care people to make sure they really do a good job, because y'all will be a direct benefit of this. The contingent from Internet 2 went and met with Bureau Chief for the Bureau of Wireline Competition, and she cleared up a couple of things that had caused some confusion, but she made it very clear that this was an opportunity for them to change the way they've been administering not only eRate, but rural health care. I wrote an exception for the proposal so that we could look to tie school nurses having their connectivity through eRate in the school system, along with small clinics in small towns, the concept of community networks. Well, the official pronouncement that came back made it, it was obfuscated by lawyerese, made it appear that you could not share a circuit with eRate traffic and rural healthcare traffic. That is incorrect. What you have to do right now is prorate. You could have your in a small town in Texas, this is a very important issue in Texas, in a small town in Texas, the school nurse may also be the city or the county nurse. And she may have a clinic, a not-for-profit clinic facility in the town somewhere. And we were very concerned that we were going to have to be doing two T1s, two totally separate circuits with two totally separate matches. That's not true. What they've said is, you can share the circuit, bring them together, just prorate and say, put this much on eRate and this much on rural health care. I don't know how much that affects y'all directly, but long term, those of you who work in rural America, the concept of community networks is the only way we're going to be able to continuously sustain rural health care, K-12, and some of the other opportunities. So we're working real hard at the legislative side to get the congressional intent clarified in the 1996 Act. There's words in that act, that Telecommunications Act, that has confused a number of issues at the FCC. So we're trying to do things so that we can really build community networks. And that's all I wanted to put forward. If anybody wants more detail or anything, I'll be happy to brief you on it.
Well, now if we could just get SLD to get rid of that common carrier garbage, we could.
They'll take a small thermonuclear device.
No doubt.
Well, actually, Dallas now. They moved headquarters to Dallas.
Thank you, Larry. And I wanted to thank all the people who helped put together the program for today, our presenters and all of you, and invite you all to enjoy some lunch. Thank you.
Before you do that, James, do you have everybody's slides that talk? Okay, never mind. You'll find them on the wiki.
Thank you all.